I'll introduce our two fabulous speakers for today. First, Dr. Sheila Satya Naranja is a professor of pediatrics and adjunct professor of environmental and occupational health sciences at the University of Washington and Seattle Children's Research Institute. She conducts research focused on endocrine disrupting chemicals in plastics, including phthalates and bisphenol A in pregnancy and childhood health outcomes. She serves as the PI for the Infant Development and Environment Study, a multi-center cohort study of phthalate exposures in pregnancy and health outcomes in children. Currently, she's a member of the EPA's Science Advisory Committee on Chemicals, and she sees patients through the Pediatric Environmental Health Specialty Unit and serves as medical director of the UW Newborn Nursery. And second, Dr. Catherine Carr is a pediatrician, environmental epidemiologist, and research to practice leader in children's environmental health. She's a professor of pediatrics as well as environmental and occupational health sciences at the University of Washington. She's also adjunct professor in the Department of Epidemiology. Her research program has a special focus on the adverse consequence of exposure to air pollutants on child health, particularly respiratory conditions, including asthma. She has served on the AAP Council of Environmental Health Executive Committee, the U.S. EPA Science Advisory Board, and directs the Northwest Pediatric Environmental Health Specialty Unit. In addition to her active research and service program, she maintains a pediatric primary care practice at UW Medicine. Thank you so much to both of you, and I will let you take it away. Thanks so much.
Thanks, Suzanne. Welcome, everybody. You've heard about who we are. We've got a lot in common, and we've been long-term collaborators, so it's really a pleasure to be able to collaborate on this presentation with Dr. Sheila Satya Naranja. You're going to hear a little bit about our research focus areas. I'm going to cover my longstanding interest in air pollution in children's health, and Sheila is a national leader in endocrine disrupting chemicals, exposure in early life, and focus today on plasticizers. We also have a real commitment to research to practice and policy, and so you can see some of our advisory roles here. We have no disclosures. Our objectives today are to understand the links between climate change and children's exposure to environmental contaminants of concern, and to recognize the role of two specific groups of environmental contaminants of concern, air pollutants and plasticizers on child health, and be familiar with strategies for reducing adverse exposures to children. So we're all a bit familiar with climate change these days, and you've probably heard something about air pollution is bad, and perhaps even something about plastics and water bottles are a thing to avoid. But how does this all connect, plastics and air pollution and climate change? I like this graphic that was published in a nice review in Lancet Planetary Health last year on climate change in children's health that shows the really important role of, over there circled on the left, sources of emissions from human activity, including production of plastics, influencing greenhouse gases, which of course drive climate change. And climate change also alters atmospheric chemistry in a way that promotes production of air pollutants of concern for children's health, including ozone and small particles, as well as pollen. So today you're going to hear about the evidence of adverse health consequences of plasticizers and air pollution exposures for kids. And ultimately, if we do our due diligence to address climate change, it's a win-win, because as we reduce emissions that promote climate change, we will have less plasticizer pollutants and less air pollution in the environments of our kids, and ultimately that relates to better health. So I'm going to start off on this topic of air pollution, climate change, and health, and let Sheila follow up with her research focus on plasticizers. So here's the cartoon from the recent National Assessment of Climate Change, and it shows again how the emissions from industrial processes, agricultural production, traffic emissions, and wildfire smoke provide direct sources of air pollutants and greenhouse gas contaminants from sources such as small particles and wildfires and ozone. Climate change actually fosters the production of secondary contaminants in the atmosphere. So it promotes the production of ozone as well as formation of small particles. And lastly, pollen season is longer and the concentration of pollens is increased under climate change scenarios. I'm not going to discuss pollen today, but I'm going to focus on what we call the criteria air pollutants, which are the most important regulated air pollutants in the US and include ozone and small particles. There are actually 6 criteria air pollutants regulated by US EPA. And if you look at these squiggly lines, which are trends over time in air pollutants over the last 2 decades, there's some good news. With emission controls and regulation, we actually see some reduction overall in the population of exposure to these contaminants. However, you also see that these lines tend to level off in recent years. And these data are from the US EPA that show the percent of children that live in counties where air pollution exceeds our health-based standards. And currently, this applies to over 60% of kids in the US. And the most common pollutants responsible for these exceedances are ozone and PM 2.5. And these also happen to be the pollutants where we probably have the most information for adverse health consequences for children's health. So exposures to air pollution are widespread, and I think of it as a preeminent issue in terms of environmental pediatrics, one of the major concerns we need to think about. But the exposures are not equitably distributed. Compared to white non-Hispanic kids, kids who are Asian American, identify as Pacific Islander, Black, or Hispanic are more likely to live in areas that don't meet air quality standards for PM 2.5 or ozone. When we look at data on the relationship between socioeconomic resources and air pollution, almost all studies conducted in North America show that those communities where socioeconomic resources are fewer are the communities that experience higher concentrations of criteria air pollutants. Here in the Pacific Northwest, the contribution of wildfire smoke to our air quality is the new normal. If you've lived here in the last years, you've lived through it. The left side shows the really marked increase in recent years in the number of acres burned and summer particulate levels that we've experienced here in the Pacific Northwest. And on the right, it shows the impact by county in our state, also demonstrating some disparities by geography for children. I'm going to highlight the second longest bar there from the top, Yakima County. It's the second most impacted in terms of days with very unhealthy air quality in the most recent years. And this region is home to a longstanding community engaged research partnership that I participate in and have been involved in for about 15 years. And air pollution is a community priority, which has been the topic of some of my research activity. All right, kids are exposed, and clearly exposure is quite widespread. What does it mean for their health? I've had the pleasure to work with Dr. Heather Brumberg for the American Academy of Pediatrics to publish a review that summarizes where we are in terms of the evidence base for the relationship between air pollution and children's health. So if you want to know a lot more about this, I recommend you take a look at this policy statement that was published last year. These figures illustrate some of the key health outcome domains that have been associated most robustly with exposure to air pollution in children. So there's much evidence linking higher air pollution exposure in pregnancy to lower birth weight of children, as well as shorter gestational length and preterm birth. Airway health, of course, inhalation is the major route of exposure for air pollution. And so the study of effects on airway and asthma and respiratory infections and diseases has been going on for a long time and is very well established that children who are exposed to higher air pollution experience more airway symptoms. Kids with asthma are particularly vulnerable, and air pollution can be an important trigger. In more recent years, the role of air pollution in the development of asthma and the development of adverse neurodevelopmental outcomes has gotten a lot of attention. And these outcomes for neurodevelopment include behavioral health and cognitive outcomes, as well as symptoms such as autism-like symptoms and diagnosis of autism. The smaller little body on the slide there represents a more modest size evidence base, but a really emerging inquiry on whether air pollution is responsible for some other major morbidities in children in the US today, including obesity, increases in blood pressure, pediatric cancer, and whether air pollution actually influences ultimately adult health outcomes. I want to share with you some of the contributions from my research team, and both Sheila and I have been involved in this thing called ECHO, which is a landmark National Institute of Health initiative that launched 6 years ago. And I think it's important for the pediatric community to be aware of ECHO program. It's called Environmental Influences on Child Health Outcomes. It's a consortium of many pregnancy cohorts around the country, and we've all aligned to share prospective data collection and harmonize our data collection. And ultimately, we are developing a data platform of about 50,000 mother-child dyads, which will be part of a public data use resource that is going to be available in the relatively near future. The program focuses on both chemical and non-chemical exposures in the first 5 years of life and their influence on child health outcomes as the child goes through childhood into adolescence and early adulthood. So this life course perspective. Our component of this consortium is called ECHO Pathways, and we bring together 3 cohorts to pool a cohort of about 3,000 pregnancies with children now followed up into middle childhood. I'm going to highlight a couple of the research questions that we've been able to address in the ECHO Pathways cohort. And we've been able to do this because we've adapted a really state-of-the-art air pollution model developed here with my colleagues at the University of Washington Department of Environmental and Occupational Health Sciences, where we can estimate a kid's or a pregnant individual's exposure at their residential point at a 2-week time resolution over time. So this has allowed us to answer many important questions on the life course epidemiology of ambient air pollution exposures. So I also want to share with you some of the recent data from the Community Engaged Research Program out in Yakima Valley that has focused on the immigrant farm working communities there. And that study is called HAPPY and has been a great joy for me to be involved in this longstanding Community Engaged Research Program. So ECHO Pathways, we've been able to do a lot of important work in the area of air pollution, and I'm just going to highlight 3 studies here. The first addresses a really critical question, I think, about whether early life air pollution can actually influence development of asthma in children. And in this study, we did a novel thing in looking at potential critical windows in relation to the well-established phases of lung development. Maybe you all recall learning in medical school or along the way, those phases of morphological lung development. And in this study, we identified the so-called saccular phase as a critical window with a 30% increase in risk of child asthma at age 4 to 6 for every interquartile increase in PM2.5 that the mother experienced from week 24 to 36 weeks of pregnancy. In the next example here, we took a look at PM10, particulate matter in that size range, on IQ in children at age 4 to 6. And we observed a reduction in full-scale IQ for every interquartile increase averaged over pregnancy in these kids. So what was interesting about this study is for the first time, we were able to provide novel data about effect modification by the nutrient folate. And so kids whose mothers were in the lowest quartile of folate actually had an over 2-fold higher magnitude of effect on IQ. So this starts to give us some insight into potential prevention and intervention methods for air pollution effects. And lastly, at the bottom, in one of the very few studies that are exploring the role of air pollution on blood pressure in children, we demonstrated that children with higher exposure in the mother's second trimester had increases in both systolic and diastolic blood pressure percentiles at age 4. And similarly, in this study, we found stronger effects for those children whose mother were in the lowest quartile of folate during pregnancy. We also estimated effects with postnatal exposure in this study, and we observed no statistically significant effects on systolic or diastolic blood pressure, although the effect estimates were elevated. So the other important thing I think about all of these studies to keep in mind is that when we estimate air pollution in these cohorts and in these critical windows, we're looking at exposures that are relatively modest or low. They're largely below current regulatory thresholds for PM2.5. Now, transitioning to my work from an intervention perspective, the HAPPY study was a randomized trial among kids with asthma aged 6 to 12 years. And what we did is we compared the well-established asthma education program delivered by the Yakima Valley Farm Workers Clinic through community health workers to an intervention that included this state-of-the-art asthma education, along with providing these families a HEPA air cleaner. You can see it on the slide here on the right for the child's sleeping area and the family living room. What we found in this study after a year of follow-up of these children is that the kids in the intervention arm had a significant reduction, about 60% less PM 2.5 in their sleeping areas. And of course, in the home is where a child spends a fair amount of their time. We also observed lower incident rate ratios for asthma control test scores in the poor asthma control range. We saw fewer reports of asthma symptom days in the kids in the intervention and less urgent care utilization. So again, some insight into what we might do to improve environmental health conditions and improve health in kids. So there's a lot of research questions and honing of the evidence base that's still needed, and we still are very active in this area in the ECHO Pathways program. But our current evidence is sufficient to support actions to reduce exposure among pregnant women and children. So what can we all do? Well, first of all, you can be a role model in your own decision-making and activities in terms of reducing your own part of emission reduction and advocate for policies that address climate change and air pollution. But as pediatric care providers, we all have an important role every day in talking to patients and helping them understand and have context for what they might do to reduce these exposures. So I'm going to highlight a couple of key tools and resources for you. The Air Quality Index, which helps understand local conditions, and preparing patients for wildfire smoke. So if you're not familiar with the AQI or Air Quality Index, this is a program that is available through US EPA on airnow.gov. It's been around for a while, and it's a really easily interpreted, color-coded system that tells you what your local air quality is. You put in your zip code or your address, and you can get a sense of what the local air quality is right now in your community and the forecast for the next days. It also, as you start getting into orange and red and those unhealthy ranges of air quality, provide some guidance on how you might modify activities or what you should do. In the last year, EPA released fire.airnow.gov, which is a similar kind of product, but it's fire focused and actually provides hourly data on PM 2.5 because fire smoke exposures change quite rapidly. It also has, is there a fire near me? Is there a plume near me? So again, good resources to know about. And of course, there's an app for that. And so you can download on your phone the AirNow mobile app. And here's a picture out the window of Seattle in September 2020, when we had the distinction of being the worst place on the planet for air quality. And maybe you don't need your airnow.app.gov. You can just look out your window and think, I probably don't need to be outside today and doing my run, etc. But again, just to show you what that looks like. There are some nice resources on like fact sheets and infographics for healthcare providers and families available from the PESU or Pediatric Environmental Health Specialty Unit program. I'm showing you one here of a nice graphic that I think informs families on what they can do to reduce wildfire smoke in their kids. It talks about the relative filtering of different kinds of masks. So a cloth mask does nothing for wildfire smoke. A medical mask, you get a little bit of a reduction, and you get the best reduction, of course, with an N95. And best of all is to the top of the slide here, go somewhere without smoke if possible. But just going inside and shutting windows and closing doors will reduce indoor infiltration about 30%. And having a portable HEPA air cleaner or if you have a central heating system, having a MERV 13 or greater filter will reduce particles inside by about up to 80%. So that's a useful thing. I think the other thing that's useful is this time of year as we approach the warm season and the wildfire smoke season is getting families to think about a clean room. What would be a room in their house with limited doors and windows where they could hang out for a couple of days if we see those days like we have seen in recent years? Obtaining a portable HEPA air cleaner that's designed for the room size, or making a homemade one for very low cost. And there's a nice YouTube video of that on Puget Sound Clean Air with a simple box fan and filter from the hardware store. If there's not air conditioning in the home, thinking about whether or not this room is going to get overly hot, and consider obtaining a room unit, and then having a store of food and medications for a period of time that you might not want to leave your house, and certainly not doing any cooking like broiling or frying that will increase pollutants in the home. I'm going to close with a plug for the Pediatric Environmental Specialty Units as a key resource for all pediatric healthcare providers on topics related to children's health and the environment, air pollution, plasticizers, and beyond. I direct the Northwest Regional Center, and you can find links to some of the materials I showed today on our local website, Northwest PASU, and on the national PASU website that we have the National Classroom. And if you want a free CME for a little bit longer version talk on air pollution and children's health, I've got something there for you. I hope that you can go away today with a little bit better sense of some of the resources available for you for addressing environmental factors in children's health. And I'm going to pass now to Sheila to take us on a tour of her focus area of endocrine disrupting chemicals, plastics, the relationship to climate change in children's health.
Thanks, Catherine. All right, can everyone see my slide? Okay. Looks good. So I'm going to talk about plastics and how they relate to climate change and child health. And so in the past 50 years, plastic production has increased 20-fold, from 13 million tons to 300 million tons from the 1960s to 2014. And you can see here this really steep incline. And this is what we see in our just general environment and how we kind of live today. When I was a child, we drank tap water in a glass, and now we bottle tap water and drink it in plastic and drink from those. And we want to know really, how does this plastic production relate to child health and also climate change? And one of the ways in which it relates is CO2 emissions. So here you can see in this graph from the Center for International Environmental Law that CO2 emissions from plastics could grow to more than 2.75 billion tons by 2050, which would be extremely detrimental to our environment. And here, both the production and incineration of plastics can produce CO2 emissions. But there's also chemicals that are used in the production of plastics and also produced in the incineration from plastics that affect human health. So I wanted to go over the types of plastics and plastic pollution that exist. And this is by no means comprehensive, but meant to give just a general overview. There are hard polycarbonate plastics, and these are used in industrial settings like an airplane. The sidewall is a hard polycarbonate plastic, or a large water bottle at your workplace that you get water from, maybe a hard polycarbonate plastic. They're also used in consumer products as well. And bisphenol A is one of the major chemicals that's been in the news and media that's in these polycarbonate plastics. It originally was in sippy cups and plastic baby bottles and was taken out, but there may be alternatives that are in them now. Then there's soft flexible plastics, and there are numerous consumer products, including flexible tubing used in healthcare, like intensive care environments. And phthalates are chemicals that are used in soft flexible plastics. And I'm happy to say that Seattle Children's is a hospital that has switched out most of its flexible tubing with phthalates to the extent that it can, but there's still medical equipment that needs to be used that contains a high percentage of phthalates in it. Then there's plastic incineration, and this produces PCBs and dioxins, and also a large amount of non-plastic chemical contaminants. And then there are microplastics. And so you may have heard of the Pacific Ocean Gyre. It's a mile-long area of plastics that are in circulation, and it makes you think of plastic water bottles or like maybe milk jugs, but really these are microplastics. They're very, very small particles of plastic, and they're extremely persistent in the environment, and they can also bioaccumulate in animal chains like fish that we eat. And so microplastics are a major problem in our environment right now. And I just wanted to highlight phthalates because phthalates are the chemicals that I have studied and that we're going to talk about in more detail throughout this talk. So these chemicals overall are endocrine disrupting chemicals, and endocrine disrupting chemicals are those that can mimic, block, or interfere with hormones in the body. And these are two books that talk about endocrine disrupting chemicals. One is Silent Spring by Rachel Carson, which discussed DDT being sprayed in the 1960s over fields, and it caused eggshell thinning. And that eggshell thinning caused birds not to be born like normal. And therefore, there weren't the normal spring bird songs that we hear every day right now, since it's March. But in this area, it was a silent spring, and there were no birds because of the DDT spraying over all of the fields. And a more modern day book that I think is great is called Our Stolen Future. And it basically talks about how if we expose fetuses to these chemicals, it can have long-lasting impacts on our health and child health. And that relates to the title of the book here. And this is written by several biologists who have focused on endocrine disrupting chemicals over time. So there are many types of endocrine disrupting chemicals, and I just want people to know that they're both natural and synthetic chemicals. There's soy and fungal estrogens that we consume, but then there's also synthetic chemicals like hormones, such as oral contraceptives, and then chemicals that are in production like phthalates, bisphenol A, pesticides, and organic pollutants. And so people might ask, well, why is an oral contraceptive okay, but these other chemicals that may affect the endocrine system are not okay? And it's because they go through phase 1 through 3 clinical trials. They are drugs that are brought to market. For every drug that's brought to market, there are hundreds that don't make it, that have major side effect profiles. And interestingly, bisphenol A was produced in the same lab as estradiol, and it was not as potent as estradiol and had major side effects and therefore did not come to production. But yet we are exposed to it through many consumer products in our daily lives. So I wanted to talk a little bit about how we study these chemicals. We do it through observational cohort studies where we look at early life endocrine disrupting chemical exposures and perinatal and child health outcomes through 2 cohorts. And both of these cohorts are part of the ECHO program that Catherine mentioned. TIDES is a pregnancy cohort that I have been involved with for over a decade, and the kids are now turning 10. And GAPS was a cohort that was actually started by Seattle Children's as a pregnancy biorepository, and now we follow the children throughout their early lifespan. We also try to look at interventions, and I'll talk a little bit about reducing chemical exposures through diet, and then try to also focus on translation in terms of policy statements and guidance to clinicians in the community. So I mentioned that phthalates are what we have studied for many years now, and phthalates are considered anti-testosterone, and that means that they reduce testosterone concentrations in the body. That can be through direct testicular toxicity, but it can also be through the cholesterol synthesis pathway. And they're found in many products. I talked about flexible tubing, but there's also vinyl flooring, soft squeezy toys. And what's below here is makeup and personal care products. Phthalates are used in fragrance and personal care products like perfumes or anything with a fragrance. They're also used in makeup and lotions because they help contain the color, make it stay better, and also make lotions more soft and easy to lather on the body. And unfortunately, they're also in all of these plastics. And so this ad says plastics, an important part of your healthy diet. And you probably can't read that very first line, but it says you could think of them as a 6th basic food group. And so this is not an ad that's in circulation anymore, but it was very recently. And the most important thing to know here is that these chemicals can leach from this plastic packaging into your foods. And so there is a major risk from eating so much food that is processed because there are conveyor belts, there's plastic tubing used in production, and chemicals can leach through every step of that process. So we generally tend to think that the more processed the food, the higher the concentration of these chemicals. And also we found that high-fat dairy and meats can contain high concentrations of plastics. And so this is extremely important, especially for populations that live in food deserts or may not have access to fresh and healthy foods. And unfortunately, these chemicals are really found in all of us. They are found in over 95% of the population. So we all are exposed to phthalate chemicals. The red here are parent compounds, DHP and DBP. And this is a pregnant mom who may be exposed through inhalation from a shower curtain, from a plastic drinking container. This is lotion, and there may be exposure through a dermal mechanism. And these chemicals get absorbed, ingested, inhaled, and then they get transferred and transported and metabolized into these metabolites, which are in green here. And those metabolites can pass through the placenta to the fetus and can affect fetal development. And so for many years, what we have focused on is how do these chemicals affect fetal and childhood development? And that is the basis of the TIDE study, the Infant Development and Environment Study. This is an NIEHS-funded multi-center study. One of the centers is here at the University of Washington and Seattle Children's, and the other centers are in Rochester, San Francisco, and Minnesota. We recruited pregnant women and obtained urine samples, and we followed infants with detailed physical exams. The first phase tested the hypothesis that phthalate exposures in pregnancy were associated with reproductive outcomes in male infants. And the second phase tested the hypothesis that these phthalate exposures were associated with impacts on neural development. And so this is kind of a graphic of what we found. What you can see here is a phthalate compound. It's a MEHHP. It's a metabolite. The names of these chemicals are so long that I cannot put them on slides, but I'm sharing with you acronyms. And what you see here are the percentiles of exposure from 25th to 75th percentile. And so the lighter color is lower exposed and the darker color is higher exposed. And what we found with the higher exposed infants is that there was a higher likelihood of male reproductive tract abnormalities, including hydrocele, hypospadias, as well as something called the anogenital distance. So we found a shortened anogenital distance in mothers who were exposed to higher concentrations of phthalates compared to mothers who were exposed to lower concentrations. And there was a twofold increase in mothers who were at the 50th percentile of exposure, and then a sixfold increase in mothers who are at the 75th percentile of exposure compared to those at lower exposures. And I wanted to go even further to determine, well, what are the mechanisms? So we see these associations between the chemical exposure and these outcomes, but how is this happening? And we thought that it could be through lowering testosterone. And so we measured testosterone in these pregnant moms, and we found that there was a 6 to 12% lower testosterone concentration with a log unit increase in high molecular weight phthalate exposure. And the short way of saying that is that the higher the phthalate exposure, the lower the testosterone in these pregnant moms. And testosterone is extremely important for male reproductive development and for normal formation of reproductive organs. So phthalates can affect male reproduction, but they have a variety of health impacts that our lab has worked on over the past number of years. The first bullet kind of summarizes what I showed visually before, that pregnancy exposure was associated with male reproductive tract abnormalities, with an increased risk of having an anomaly in relation to a log unit increase of DHP, which is a parent phthalate metabolite. And some of the measures we looked at were anogenital distance, penile width, and testicular descent. But we've also seen that these exposures were associated with neurodevelopmental changes in young children, and early pregnancy phthalates were associated with increases in autistic traits in both sexes. They were also associated with higher externalizing behavior in boys, and we saw that specifically in late pregnancy. And here there may be an endocrine-mediated effect where it's affecting boys more than girls. And more recently, from our echo pathways work that Catherine mentioned, we found that pregnancy exposure was associated with airways outcomes in children, and a summary index of phthalates was associated with increased ever asthma risk in boys, but not girls, again, suggesting a potential endocrine or hormone-mediated response. So we know that phthalates are harmful to children's health. There are now several national bodies that have commented on this in various ways, and I've listed those here: the National Research Council, the American Academy of Pediatrics, NTP, or the National Toxicology Program, and the Environmental Protection Agency. So we know that they're harmful to health, but how do we reduce exposures? And so this can be very, very hard to do. And sometimes you need policy to do that and regulation, but we've also looked at some interventions. And this is a collaboration with Dale Lee and David Susskind from GI and Melissa Mallow, who's our postdoctoral fellow. So we wanted to look at environmental exposures in children with Crohn's disease. So Dr. Lee was leading an intervention to determine if a specialized diet would reduce GI symptoms in children. And the normal treatment for these children would be high-dose steroids. And he wanted to see, well, would the diet produce lower GI symptoms in lieu of using high-dose steroids? And this kind of diet is a whole foods diet blended to a liquid consistency. And it excluded grains, processed foods, and refined sugars. And because it excluded processed foods, we thought, well, maybe this special diet would also reduce environmental exposures. And so here you can see just two chemicals that I've chosen from the wide array of chemicals that we looked at. And you can see reduced concentrations of MEHHP, which was the chemical that I showed you that was specifically associated with male reproductive tract abnormalities, and then also melamine. I haven't talked specifically about melamine in this talk, but we all use melamine in our daily lives in our tableware. There are many melamine-based plastics that we use. And I'll just orient you to these graphs here. But this was the concentration at baseline, and this is at 4 weeks and then at 8 weeks. And you can see that the concentrations have decreased with the intervention. So the intervention was introduced, and then at 4 weeks, we obtained urine, and then at 8 weeks out, we obtained urine. And so the concentrations really did decrease with this diet. Now, there are other chemicals where they did not decrease. And so sometimes the diet may be related to certain chemical exposures and not others, and that's what we continue to explore with this kind of work. Other ways that we're trying to work towards positive change are by participating in statements from the American Academy of Pediatrics. I was fortunate to work with Rachel Schaefer and Leonardo Chisande at NYU on food additives and child health. And these were two statements, one technical report and one policy statement put out by the AAP that talked about food additives and how they can impact child health. And from this came this New York Times article on chemicals in food may harm children, the pediatricians group says. And this says, eat more fruits and vegetables, don't put plastic containers in the microwave or dishwasher, and check recycling codes to reduce exposures to chemicals. Another way that we've participated is I have participated in the Washington State Phthalate Advisory Plan Committee as a member as of this year. And I specifically put this up here to show that it's not just research and publishing that will help change the course. We need to also participate in these committees and these policy statements to really make a positive difference. And sometimes these are not compensated or they're not effort that may be recognized, but it is very important to do. Other guidance that we can give are to reduce use of single-use plastics. If there's one thing that comes from this talk, I think you can tell that our use of plastic is really out of control in our society, and it continues to increase, and we really need to focus on that to try to reduce chemical exposures for our general population, but also to combat climate change. Diet may be a large source of exposure, so we can choose fresh and frozen foods when possible, avoid plastic and use stainless steel and glass Tupperware. Don't heat foods in plastic. That will definitely cause leaching from plastics into the foods. And just in general, to reduce your overall environmental exposures, you can take your shoes off at home, keep your carpets and windowsills clean, and then use reputable sources to reduce chemical exposures. And here I've listed the Environmental Working Group and NRDC, who have great resources on reducing chemical exposures. And I wanted to show you one example before I close out. Here is Vaseline Intensive Care Dry Skin Repair Lotion. And this is from the Environmental Working Group's Skin Deep database. And they basically rate products. So this was the lotion that I used my entire childhood. So I'm probably dating myself. So I wanted to know, well, what are the chemicals in this and could it be harmful for my health? One in green is low toxicity and red is very high toxicity. So this is sitting right at the middle. But what's very interesting here is that they will break down the ingredients and tell you about the different toxicities of the ingredients. And you can see here that there's one ingredient called fragrance, and this is likely where phthalates are in this product. And on the right-hand side, it talks about endocrine disruption. And so it breaks it down at the level of detail of specific chemicals. And there are many citations here. So I find this website very useful, and it's put together by toxicologists. And now I want to close out by showing our training opportunity here. Catherine Carr and I lead this Pediatric and Reproductive Environmental Health Scholars Program. And this is a 2 to 3 year K-12 fellowship funded by NIEHS. And it's for early career clinicians interested in academic environmental health research training. There's up to 75% protected time for research, potentially more if people are interested. And we wanted to give some examples of projects. So if you're in pulmonary, the relationship between lung function development and environmental factors may be interesting. If you're in GI, the relationship between chemicals and diet and GI disease. If you're an endocrinologist, how chemical exposures may impact hormone-mediated disease may be of interest. And we would love to have anybody who's interested join us, join our team and go through this funding. It is meant for people who are trying to transition to academic careers, and the email address is here, but you can also contact each of us individually if you might be interested. And with that, I wanted to just acknowledge the many components that have contributed to these slides in our presentation. The TIDE study team, Dale and David Suskind, Drew Day and Melissa Malo are postdoctoral fellows who work in our lab, the Echo Pathways team, the Happy Study team, and very importantly, the study participants. None of this would be possible without our amazing study participants. And there's a large amount of funding that has contributed to everything that you've seen here, and it is listed on this slide. And this is a PACU program funder statement, which is important for us to show from the PACU program where we do consults. And with that, just wanted to say thank you very much for listening to this presentation. We're happy to take any questions.
Great, thank you so much. It looks like there's a few people who may not be able to see the screen quite as well. So for those of you who have questions about those last few references, let me know and we can get you a copy of that. And for everyone else, you can feel free to either unmute and ask a question or type it in the chat box and I will read it out for you. Thanks so much. We have about 15 minutes for discussion if anybody wants to bring something up.
I have a question for Catherine and a question for Sheila. First of all, this was like such a fantastic presentation. I'm one of the PEDS interns, and really appreciate this. But for our lower income patients, my clinic is in South Park, and we have lots of kids with asthma. Is there any that you're aware of, like community programs or public funding available for HEPA filters or anything like that in the home for these patients? That's my first question.
Yeah, thank you for that question. The short answer is I'm not aware of anything where, like where the time we've had programs with, free bike helmets to distribute, or I'd love to see the HEPA air cleaners available. I'd love to be able to write a prescription for one. And I think that's part of our motivation for the study that we did, is to sort of add to this evidence base to kind of promote that future. I will say that, I did show on that one slide, you can make a pretty low cost version of a HEPA air cleaner yourself for about $40, which, is still money, but it's a lot different than maybe, $200 or so for an off the shelf portable air cleaner. So the Puget Sound Clean Air Agency has this really nice video, and it walks you through. It's a simple box fan, that you would get at the hardware store or Lowe's or Home Depot, and a furnace type filter, and duct tape, and it works. So there is that. And actually, my colleague here at the University of Washington is going to start a study pretty soon that is going to actually, test this with homes of kids with asthma. So we'll have real data on asthma outcomes. There's real data on exposure reduction. And I think there's enough literature in general to show that if we reduce exposure, we're going to see those health effects. But anyway, that's kind of long-winded to say, no, I don't know of any specific programs, but there are ways to educate families on how to make a low-cost version.
Amazing. Yeah, I see that link. I screenshotted that. Thank you. And then my question for Sheila, just is there any sort of I know you gave a lot of resources, but any cheat sheet for things that we should have families avoid plastic wise, that's just a little bit more easily accessible for us to give out in clinic or anything like that you're aware of?
Yeah, thanks for asking. So there are fact sheets from actually our Pediatric Environmental Health Specialty Unit. So you can go to that website, and there are a number of fact sheets, both for clinicians and the public, but there's specifically a fact sheet on phthalates and bisphenol A, and talking about how to reduce exposures, and it summarizes what I had on the slides. And it goes into a little bit more detail about recycling codes and the specific chemicals that are related to plastics as related to those recycling codes. So I think that that's probably the easiest thing to print and hand out to families.
Suzanne, are these slides available to people so that those hot links and stuff that we have in the presentation, can we?
Yeah, great question. If you signed a consent, which you probably did, then this talk is going to be posted on Child. It'll probably be up in a couple weeks, and it will be there for a year. And then in addition to that, if anybody wants a copy of your slides, they can email me or Emily Rice or you, and we can send them the whole presentation if you guys are okay with that. So yeah, lots of ways to make this accessible. Just let me know if you are participating. You can send me a chat message and let me know, and I can get you the physical, or the not physical, but the copy of the slides. And then also you can watch this on Child at any time.
Yeah, and also, just feel free to reach out to me directly, or PEHSU, PEHSU, you Google it, you'll find us, and it's not hard to find.
Yeah. And PEHSU is a really, really great resource for everyone who's listening to this. I actually consulted them today, so we really appreciate you guys there. And then also Nancy Baudet had a comment for everyone. Puget Sound Clean Air Agency did provide box fan filters to low-income families at no cost a few years ago, but not sure if they still have funds to do so. And then a question from Dr. Walker Harding. What is one thing we can do today to decrease exposure to us and to children?
Just one thing?
Give us, well, we have 10 minutes of things. Yeah. Tell us all your things. I'm realizing that myself, I need to clean out some of my drawers because I have a lot of plastic going on. So yeah, tell us.
Oh, that's a hard to pick one. I mean, I think, if you want to think about chemical hazards generally, I think Sheila had one slide about dust control, because we do find a lot of these especially from a small child perspective exposure. Um, if you keep your, sort of dust under control, you take your shoes off when you go in your house, you keep dust under control, that's an important exposure pathway for phthalates and a whole lot of other chemicals, lead and other that we haven't even talked about today. So, that's kind of a really basic one. And then from air pollution, I just think about, your car trips and your single, person car trips and those kind of decisions. Your next car, maybe it needs to be electric. I thinking about just those sort of consumer decisions. And I think Sheila provided some really nice practical guidance in terms of, how, thinking about avoiding the plastics when you're doing your grocery shopping as much as you can and um, the fresh and frozen produce versus, things all packaged up and over processed. I don't know. You got any other comments on that, Sheila? It's hard to just say one.
One thing is really, really hard. I completely agree with Catherine. I tend to focus on diet and trying to have, as healthy of a diet as you can. And as related to this talk and climate change, really trying to reduce our use of plastics overall in our just general daily lives. When the pandemic hit, I was just really appalled at the amount of plastic that went into production because, we had takeout, we had all sorts of different things to make our lives more convenient. And it may have been a necessary piece at that time, but I hope it doesn't continue.
Agreed. Thank you. This is a good question from, oh, go ahead,
Oh,
Sarah.
sorry. Could I ask a specific question about food purchasing and sort of avoiding plastic when you're buying food? I found that incredibly difficult to do, even when you're buying frozen produce or even certain kinds of fresh produce. It's quite hard to get it without plastic. So I was just curious if you had any practical tips on how to do that if you're not able to, make everything from scratch.
Join your community
your own flour.
CSA. Have you got familiar with the, community supported agriculture? So there's a lot of, it's kind of direct from producer. So there's these opportunities, you can get a box delivered to your house or someplace in community. And it's, it focuses on locally grown, which reduces emissions from, long transport. And you can select organic or not, or conventional, but I think, it comes in a big box and not packaged up in plastic. So that's one opportunity to think about, and it has a lot of cradle to grave goodness about it in terms of pollutants. I know. I remember just before the epidemic, I'd gotten really good about measuring, weighing my glass bottles, and I would go to the bulk section and then use that same, jar to fill up with beans or whatever. And it's great. And then with COVID, suddenly everything was in the little plastic and it was really hard, but we're moving back. So I think again, if you look for it, you can start to find ways, small steps, and all, when you look at all of our behavior, it can really make a difference if we were all, sort of buying these things in bulk rather than in the individual containers, things like that.
I think, it really reflects kind of our global food production chain that, we get things from thousands of miles away, and the only way that we can get those is if they're produced and put into plastics, because plastics don't degrade. And if you, have traveled to other countries, the way that food is distributed is really different. Food comes much more locally, and you eat things, based on what's in production locally. And therefore it's much more fresh. And so, that I totally agree with Catherine, the CSA, but also putting foods into glass when you can, using the reusable kind of cloth bags for your produce instead of plastic bags can also help. If I don't have those, I just put the produce in directly into my regular bag. You know, I don't know why we need the plastic bag and then into another plastic bag or into another bag. It's just something that we've gotten used to. So there are small ways, but there certainly are still so many products that we buy that are in plastic, and it will just take time and more education to change that trend.
Eric has a comment in the chat. I appreciate it. It's also, making a plug for farmers markets. And, when this city is really, our local environment here is really rich with neighborhood-based farmers markets. So, and it gets even better, as we get into the growing season now. So that's another good way to avoid all this packaging and long range transit of foods that we like.
Such a good reminder. There's a couple really great, maybe tough questions in the chat, so I'll keep going. From Lillian McKinley, thanks for this amazing talk. This is a very specific question, but are synthetic hormones in waste products filtered at waste treatment facilities, or is this also entering the water system?
That's, yeah, great question. No, it's definitely entering the water system. And if you're in this field, there is kind of a giant of this field, Tyrone Hayes, who was a scientist who looked at those hormones in our water systems and found that there were certain types of amphibious animals that were basically having reproductive male and female reproductive organs over time. And so it really was changing their reproductive cycles. And so, no, it is not filtered. It is going into our environment, and it's likely affecting our ecologic environment.
Thank you, and bummer. And from Angela Zhang, there's a history of companies marketing products with harmful chemicals more to communities of color, like Johnson & Johnson with talc powder that contained asbestos primarily to Black women, or stores stocking different products by neighborhood. Do you have any more current data that bear out this trend either nationally or locally? That's a great question.
Yeah, it is a great question. I mean, I think what we do know is that BIPOC populations are more exposed to these chemicals, and that's been seen in multiple studies over time. And in terms of marketing, I will say that as somebody who's kind of both been attacked by industry and followed industry trends, it changes very, very quickly. It can change overnight, the marketing strategies by these companies. And so that's really hard to assess as to whether it's been marketed to certain populations, but certain populations are certainly exposed at higher rates. And I was trying to get at that with the concept of the food deserts. We've been having kind of a privileged conversation here when you talk about CSAs and using glass containers. There's many populations that don't have access to those resources, and therefore they are at higher risk of exposures, and we do see higher exposures in those populations. And so I do think that there are several advocacy groups, and now the research community is getting on board as well to try to address these issues and to highlight them and then work towards interventions.
Thank you. We have time for one last question, so I'm going to pick one because I want to know the answer to this too. Does frozen produce absorb less plastic than packaged fresh produce at the grocery store? Trying to understand how frozen reduces exposure when it's packaged in plastic.
Yeah, that's a good question. So when we talk about plastic exposure, I don't want people to think that, like, if you put your celery in a plastic bag, that celery is then automatically contaminated. That's really not what's happening. That's more related to just CO2 emissions and using more plastic in generally. What we are talking about in food production is either in the processing, like through the conveyor belts or through the actual production of components, there can be contamination. But on the consumer end, as you're buying foods and thinking about it, it's more like the TV dinners that are in plastics, or if you microwave your food in plastic, that's when leaching will occur into plastic components. I mean, into the food components. And so it's really more about heating the plastics and the leaching from the heating. Also, if you use, like, let's say the same plastic water bottle, like a hard polycarbonate water bottle, it will degrade over time and you can get exposure in that way as well. And so that's why we recommend to not dishwash plastics, but to wash them by hand so you don't get as much degradation. And people often ask, they're like, well, do you use any plastic in your household? Of course, yes. We all use plastic every single day. I just use plastic for things that are cold, and I eat them cold out of the plastic container. So we don't need to contribute to the major waste stream by throwing away a bunch of plastic, but it's more just about how to use it so that you're not being exposed.
Thank you. We're out of time. There's one last thing. I would just want to put Ellen Pasloff at ease. I think putting sandwiches in plastic bags, did that hurt Ellen Pasloff's kid? I don't think so. I don't think so. But
I doubt it, but there's many other alternatives than those plastic bags. That's all I would
And
say.
now it's getting so much easier to find reusable sandwich containers too. But I think your kid's probably out of grade school. So, all right. Thank you so much. I know Dr. Carr at least has to go be a general pediatrician. I appreciate everyone who came to this awesome Grand Rounds, and thank you so much for both of our speakers. To our audience, we'll see you all next week, and feel free to reach out to me or our speakers if you want copies of the slides. I already got a couple of messages. So thank you so much. And Sheila and Catherine, if you have time, look at the chat because there's lots of great comments for you that we didn't have time to get to. So thanks everybody, and we'll see you all next week.